Like all Malaysians, I am deeply concerned about the rapid spread of COVID-19 cases in Sabah during the last 3 weeks. Since 1 October, 54% of new COVID-19 cases in Malaysia occurred in Sabah alone. Equally troubling is the mortality rate of infected patients in Sabah is very high, and we also see deaths among younger patients without pre-existing conditions. In light of these developments, there are several issues which require further explanation by the government. Firstly, Sabah's healthcare system, which is already underfunded, understaffed, and under-resourced, is now inundated and overwhelmed by the epidemic. KKM has been diverting resources to Sabah, but the ministry cannot do this alone. This effort needs political support from strong leadership and the involvement of NEDMA and other ministries to mobilize adequate medical teams and equipment, improve logistics, and provide wider reach of aid. Secondly, experts have indicated that we are likely to see continued increase in the number of cases in Sabah as the virus is spreading in the community. They have recommended that massive testing could be a means to identifying and isolating spreaders before the infection spreads further. 8 months into the pandemic, Malaysia should have the capacity to conduct large-scale testing. The Ministry of Health must provide full disclosure to the public of its strategy to contain the spread of COVID-19 in Sabah through testing and other means. Thirdly, given that much of Sabah is under Controlled Movement Control Order (MCO), and millions of Sabahans are enabled to resume regular work and school, I call upon the government to assess the need for special emergency financial aid and food assistance to affected areas to ensure marginalized communities have the basic means to survive the current crisis. I also reiterate my earlier call to extend the loan moratorium nationwide as one of several immediate steps which can be taken to bring relief to people and small businesses not only in Sabah, but across Malaysia. Lastly, it is imperative that data about cases, testing and mortality are shared openly with healthcare professionals working in collaboration with the government to confront the pandemic. The lack of information prevents experienced professionals around the country from doing what they can to assist. A more open data policy will rebuild public trust in the government's handling of the pandemic. Anwar Ibrahim.